Thanks a lot joining us today, Dr. Richard. So to begin with, I would like to ask, how did the pandemic reinforce global investments in healthcare, and how it's made that crucial, particularly for communicable diseases?
Well, I think the most important advance during the pandemic with respect to vaccine development certainly was the validation of new technologies. And these are the technologies that everyone is aware of, certainly the mRNA technologies, but also a variety of other platforms for developing vaccines on what are called viral vectors and also protein-based approaches to vaccine development. I would say that the pandemic, the urgency of the pandemic actually compressed the development timelines for some of these vaccines from what used to take 10 years down to less than a year. And so we're coming out of the pandemic with a whole new array of tools that I think we can use both to improve healthcare generally, but also that can help us be prepared for future epidemics and pandemics.
So why is COVID-19 vaccine inequity still a global, still a global concern, and what should be done to close the vaccine equity gap? Not just COVID vaccine, if you can just throw a light on a broader perspective on this.
Well, I mean, historically, there have always been equity gaps in access to new life-saving medical technologies. And there was an equity gap with the distribution of the vaccine. There's been dramatic improvements, of course, over the last couple of years. I believe the number of doses that have now been distributed globally is around 13 billion. And we're only a little over 2 years into our experience with this virus. So that's, or 3 years, I guess, at this point. But that's, just astonishingly rapid compared to historical norms. Our analysis of the equity gaps are that it was a systems failure. And you can understand inequitable access when supply is dominated by scarcity. And by the end of 2021, that scarcity situation had largely resolved. Vaccine production had scaled up dramatically, but then there were problems with financing, problems with delivery, problems with healthcare systems being ready to receive and use the vaccine appropriately or to reach the populations that needed to be reached. And until we had addressed all of those problems, we weren't really able to begin making progress against the vaccine equity challenge. The countries that are served by COVAX, which is the mechanism that we set up with Gavi, WHO, and UNICEF to procure and deliver vaccines, also to develop them. The countries the vaccination rates in those countries in aggregate now is above 50%, which is remarkable. There are still countries where vaccination rates are quite low, unfortunately. I think the experience with COVID has thrown a very harsh spotlight on this question of equitable access to medical technology. I think the conversations that are now being had about how do we share global public goods, how do we make sure that regions have some degree of capability and self-sufficiency are relevant to other medical products and technologies. And so I think although it has been a struggle in responding to COVID, the world will be in a better place going forward, not just for emergency vaccines and diagnostics and therapeutics, but for other technologies.
I would like to ask, why is it still critical to keep pace with COVID-19 vaccines? Because there's kind of lethargic attitude because the numbers have gone down. So why is it critical? And why do you think scaling up the delivery capacity of Covovax is still critical?
Well, I think it is critical to stay on top of COVID because the virus is continuing to evolve. And we've seen these waves of disease caused by sequential new variants of the virus. And there's nothing that would prevent the virus from ultimately evolving to a point where the current vaccines might begin to lose their benefits. And so the other thing that I think we're focused on particularly is that coronavirus as a class will continue to present a threat. We've seen about one new coronavirus every decade over the last 3 or 4 decades, and we should anticipate that there are more coming. So if we can develop vaccines that protect not just against COVID and any future variants of COVID, but that protect against other coronaviruses, that would be a great benefit for global health security.
Okay. So, what are some of the biggest challenges that are around vaccine manufacturing, like moving away, like in particularly to India? I would like to ask, like, the biggest challenges in vaccine manufacturing that you see.
Well, the biggest challenge of vaccine manufacturing right now, and I think a contributor to the vaccine inequity that we saw in 2021 in particular, is structural. And it's that vaccine manufacturing is concentrated in just a few highly populated regions of the world. That the political leaders in those regions have to serve their own populations before they can worry about serving global needs. And those areas of manufacturing, of course, are certainly here in India, but also China, the US, and Europe. And so we need to see more globally distributed capability. There is some globally distributed capability, but not enough. And that globally distributed capability needs to have access to these newest cutting edge technologies that served us so well. There are other challenges with vaccine development and manufacturing and delivery. The mRNA vaccines, as you know, have very stringent cold chain requirements, which makes them difficult to use in some environments. I think that problem will be sorted out over time. The companies, our private sector partners, have incentives to improve their vaccines, and this is still a relatively new technology.
So, what are the long-term effects and the learning from the pandemic for CEPI, like from the pandemic? And does COVID-19 provide an opportunity to build more inclusive vaccine distribution?
I hope so, certainly. I think that one of the long-term learnings from the COVID experience is that we have to change our understanding of health security for the 21st century. Infectious disease threats are accelerating. The pace at which new diseases emerge, their potential to spread globally, is being heightened by human factors, but also by climate change. And so we need to be prepared for future threats, and we need to make investments to be prepared for future threats. And those investments include both investing in the science and in creating what CEPI has called a global vaccine library that would help us respond to new threats. But it also means investing, as I think your question was implying, in delivery capabilities. I think COVID actually, in many countries, the vaccination campaigns for COVID were the first time that many countries tried to deliver vaccines to vulnerable adults. And I think we should build on that, because there are other vaccines that could benefit adults in countries all around the world. And if we use this opportunity, this beachhead that COVID has provided, to build better delivery capabilities, not just for childhood vaccination, but for adult vaccination, and what we call life course vaccination, we can start providing health benefits to people right now and build a foundation for responding to future threats.
If you see the vaccine industry in India, like how are we doing? Like how is the pharma in we call it sunrise industry, but how do you see it? Like,
I have nothing but praise for the vaccine industry
Okay.
in India. India's contributions to global health before COVID, certainly in terms of its vaccine production, are enormous. I mean, I think the majority of vaccines globally are produced here in India. But India's response to COVID and both the innovation and the production capability, the manufacturing capability, were second to none. I think it's correct to say that India has a greater diversity of approved vaccine products than any other country in the world. And a lot of those were homegrown vaccines.